Hello, my name is Jenny and this is Dr. Sandra Bazoglu's pre- and post-op breast reduction video. First and foremost, Dr. Bazoglu wants to ensure that you can contact her at any time for questions, concerns, or emergencies. So let me give you her cell phone number, and that number is 859-229-3466. Now let's begin. Let's start with the day before surgery. You will have been in contact with Dr. Sandra Bazoglu in reference to a pre-op visit. This is oftentimes done either in the office or over the phone. Arrangements will have been made for you to pick up a prescription for pain medications. Now, these can't be sent through the computer and can't be e-script or called in through the telephone, so it will have to be picked up here in the office. And the day before surgery, you'll have that prescription. You'll also have given us the name of a pharmacy that we will send over prescriptions for antibiotic, anti-nausea medications, and possibly something to help you with motion sickness, and that is a patch that goes behind the ear. All of which Dr. Bazoglu will discuss with you during your pre-op encounter. Again, you will pick up your narcotic pain medication prescription, but all the other medications will be sent through the computer to your pharmacy. On the day of surgery, arrive here to the office through the front doors that you came in originally on an empty stomach. This is what we call NPO. So you want to make sure to not have eaten nor drank anything since midnight the night before. So you'll show up here on an empty stomach, and in hand you'll have all the medications that we prescribe to you. That pain medication, the antibiotic that you went and picked up at the pharmacy, as well as the anti-nausea medication you picked up at the pharmacy. Bring all of that with you. Now, I do not need your home medications. There's no need to bring any of that. So that's rule number 1 and 2 right there of the 4 rules that are necessary for both pre and post-op for breast reduction. Number 1 was show up on an empty stomach. And number 2 was bring the medications that's been prescribed to you. That's the day of surgery. Your family will wait in the waiting room. There's no need for them to come back for pre-op. Pre-op is when you come back to the preoperative room and you meet Dr. Bazoglu yet again and have any last discussions before surgery. You'll also meet the anesthesiologist along with the surgical team. This will usually take about 20, 25, 30 minutes at the most, and then you'll go straight into surgery. So your family can expect to be in the lobby for this breast reduction surgery roughly about 2.5, maybe 3 hours at any time that they want to leave, maybe perhaps to go run an errand or get breakfast. They just simply need to leave their cell phone number that they have on themselves with the front desk so that they could contact them if needed. Now, the surgery itself takes about 2 hours, and during that surgery, the specimens that are removed will be sent to pathology. We'll take care of all of that, and you'll have those results in about a week. Oftentimes, those results are even ready during your post-op visit, and you can get the feedback from that. After surgery, you'll wake up in the recovery room. Now, the recovery room is just across the hall, and you'll get that tutorial whenever you arrive at pre-op. The surgical bra will already be on you. This is a surgical bra that fastens up the middle. This bra is to stay on for 24/7 for 2 weeks. After 2 weeks, you can remove it at night only, which makes you have it on all day for 4 weeks. That's going to be best case scenario because you're going to feel more comfortable having this on, and you're going to be more protected at your incision sites and with more support. It's going to help with the pain, but it's also going to help with swelling, which is a big occurrence after surgery. So when you wake up in recovery, this will already be on. And once you're tolerating sips of water, and you will probably have already even had some pain medication given to you by mouth, your family can come back with you. At that time, we'll review and touch on just a few things from this video for post-op teaching. But they are encouraged to watch this video prior to surgery with you so that if you have any questions, it can be given, a demonstration can be given at post-op. For instance, you reinforce as needed whenever you have any leakage or bleeding or anything that night that you go home. And sometimes it happens in post-op, and we can give a demonstration on how to do it, but the bra comes around the front and fastens up the middle. We're going to send home with you a pack of 4x4s that you can use to reinforce if you have any bleeding or drainage. And you just pull up that bra and stick a stack of those 4x4s, about an inch worth, up underneath there to what we call reinforce. Now, Once that bleeding has stopped, leave that in there and don't take it back out. You can cause problems then with reoccurring bleeding. But everything that you'll wake up that's already been put in the bra, which is to say the post-op stuffing that's been put in there, is all one piece of cotton. So don't start pulling stuff out if you have leakage or drainage or anything post-operatively when you get home. Just only reinforce. Again, pull that bra up, stick it up in there, or maybe pull the bra down like this and stick some cotton down in there to help reinforce and give yourself a pressure dressing so that it'll stop the bleeding. This does happen occasionally 6 to 8 hours after surgery. If you have active bleeding that is saturating those dressings and you need to call Dr. B, you do have her cell phone number and we would encourage you to do so. All right, that evening, so that takes us through pre-op, arrival to the surgery center, through the surgery, and into recovery. We've talked about what to expect there. When you go home, you want to make sure that you have someone with you for 24 hours. We've talked about reinforcing as needed if you were to have any oozing. We've talked about not removing the garment already and how long you'll need to leave that on. Make sure that you take your pain medication as instructed every 3 to 4 hours. And for the first day or so, just go ahead and take it. You'll probably need it. But after you get to the third, and especially by the fourth day, you need to be converting over to taking just Tylenol because you'll be on extra strength Tylenol by about the fourth or fifth day and no need for narcotics any longer. If at any time you feel like the narcotics are causing nausea, you'll have medication to help with nausea, but we would encourage you to get off of the narcotics a little quicker than not. For instance, if by that second day you're already feeling like kind of queasy from the narcotics, just try extra strength Tylenol. Do not, however, take the narcotics with extra strength Tylenol together because this combination of narcotics has Tylenol already in it. You will be double dosing on the Tylenol, so do not take them together. It's one or the other. Now, reclining. Reclining is going to be really important for part of your post-op care, and this applies as soon as you get home, but also for the next couple of days. Remember that gravity is going to pull the fluid to right underneath your breasts. You're going to swell because that's what you do after surgery, but it's going to pull fluid to underneath your breast, which is exactly where your incisions are. We want to encourage you to always be reclined, and reclining will help disperse that fluid so that you don't gather underneath your breasts where your incisions are, making it difficult for those incisions to adhere. So keeping your bra on, but reclining is really important. Make sure that when you are laying and doing a lot of resting, that you're also deep breathing and coughing. And what we encourage you to do is to take 10 deep breaths and some coughs every hour. Every 1 hour, 10 deep breaths and some coughs. Also remember that when you're laying in the bed, you need to be extending and stretching your feet and legs and stretching out to encourage circulation so that you don't get a blood clot. That's important too. But be up, be going to the bathroom, be moving around the house, get yourself something to drink, and go and lay back down. That's perfectly fine to do. One of the problems with reclining all the time, and especially in a recliner or on the end of a couch, is you do have to get up out of that recliner, which can be tricky. So rule number 3 comes right here. When you're getting up, whether it's out of the car, out of the bed, out of the recliner, make sure that you cross your arms. If you cross your arms, that'll force you to use your ab muscles, use your butt muscles, and pull yourself up to a sitting position, in which case you'll use your legs to stand yourself up. That'll help prevent any violation of the 5-pound weight restriction. There's a 5-pound weight restriction for pulling, pushing, or lifting anything, and you need to adhere to that for 4 to 6 weeks. Now, if you are in a recliner and you push yourself up out of that recliner, you will have stretched those incisions and twisted all at the same time. We encourage you, rule number 3, cross your arms when you're getting up from a sitting position. On post-op day 2, that'll be the first chance that you'll have to take a shower. Now, this brings us up to rule number 4. The final rule is important because it's that first shower that is more than you've done in about 2 days. And a lot of people get lightheaded and maybe even short of breath, but are really dizzy from that very first shower. Make sure that you're sitting down when you take the dressing off, and make sure that someone is in there with you. Rule number 4, someone is present while you get your bearings and get in the shower. They don't have to get in the shower with you, obviously. So you want to unfasten that bra at the front and open it up and take it off. All of that cotton will come off. There's even some yellow zero form that's kind of stuck to you a little bit. Just get in the shower. Get in the shower, get that wet, and let it come off in the shower. That's not a problem. Don't pull at your incisions. Know that when you're washing your incisions, you may feel that they're kind of rigid and notice that they're red perhaps, and that's all going to fade in about 6 months. And some of the redness and the coloring can actually take up to 2 years to turn back to your natural pigmentation. While in the shower, we want you to use the item that we sent home with you, which is a pump soap. You don't have to use this one if it's too foo-foo smelling for you. If you choose to use a non-scented soap, that's fine, but make sure that it's a pump soap. No bars of soap, no loofahs, no washcloths. I want you to fill your hands up with soap, wash your breasts, wash the incisions, but don't go back to your breasts. You can wash your hair if you want, and I don't want any of this bacteria here, and I don't want any of these bacteria here. So wash your breasts first and do not go back to them. Rinse, 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 and that's perfectly fine. When you get out of the shower, I want you to have a bowl in the bathroom so that you can mix up a half and half strength peroxide concoction. So nothing scientific, just put some peroxide in a bowl and get you some tap water and make sure that you're roughly about half and half strength. Then I would take some more of these 4x4s that you'll have plenty left over and get some of the cotton, saturate the cotton in the peroxide mix and clean that incision real well, throw that one away, get some more cotton, saturate it, and clean this other incision real well. This is a one-time peroxide wash that we want you to do, and it gets the betadine and the blood and things off that might still be stuck on there from surgery. Make sure that you do not continue to use peroxide. As tempting as that may be to keep yourself clean, it will actually work adversely by drying you out and can cause some problems with your incision. So it's a one-time peroxide wash. If you are too weak after getting out of that shower, because it does take it out of you a little bit, feel free to catch that peroxide wash on the next shower. Do not feel like you have to push it that first shower, but just have it done in the first or second shower. You're going to dry off after that, and you're going to put that bra back on. And when you go to put that bra back on, you're going to want some barrier between the incision and the cotton of the bra, rather. So you want to take these 4x4s and line it along that incision. It's a two-man job, let me tell you. And make sure that you have cotton along that incision. Fasten that bra back up. Even perhaps pulling it open to put some cotton on your nipples. Again, you're going to be more comfortable if you don't have friction from the bra against your incision. Also, at this time, you probably are still going to have a little bit of drainage, and that 4x4 is going to catch that, and you're going to be able to observe your drainage and keep an eye on that to report back at your post-operative visit. All right, that brings us up to the post-op visit, and we've already covered the 4 rules. Rule number 1, show up on an empty stomach. Rule number 2, have all your pre-op medications. Rule number 3 was cross your arms when you're getting up from any sitting or reclining position. And rule number 4 is to have someone with you whenever you take a shower, just till you get your bearings and get in the shower. At the follow-up appointment, we'll assess whether or not you have excessive amounts of bruising or how much bruising you have. Again, as I mentioned, you may even have your pathology report back by then, and Dr. Bazoglu will go over that with you. You are not to drive the first day of surgery, obviously, for that 24 hours post-operatively. But if you are off of narcotics for 24 hours, feel free to drive as soon thereafter. So there isn't a restriction on driving, except when you feel like you can do it and you definitely have not had any narcotics in at least 24 hours. You can go back to work after 1 to 2 weeks, especially if you have a desk job. And you just want to keep in mind that reclining position whenever possible, so that you don't have a lot of swelling underneath. Gravity is going to pull it forward. However, if you have a job that does require any manual lifting, and 5 pounds is the weight restriction, then you're going to want to make sure that you're off for at least 4 weeks. Any strenuous activity included. Again, I'll reiterate to call Dr. Bazoglu if you have any problems at all, especially if you have any calf pain in the backs of your legs, any sudden onset of shortness of breath, numbness or blueness in the extremities, If you have any chest pain or a fever greater than 101, you need to give her a call. And most importantly, if you have any severe pain that isn't relieved, even minimally, with the narcotic use, you need to make sure and give her a call for that as well. We're very excited about your surgery, and breast reduction is a phenomenal, life-changing event. So thank you very much, and make sure that you call Dr. Pizzaglou for any needs at all.